Welcome to Edentu. Under this, we are going to see about what are all the important topics required for PG entrance exam preparation. In that, we are going to focus about the anatomy part of it. So what do you think is the key detail or the key thing that you have to remember while preparing for entrance exam preparation? It is the time. Time is a very important factor. So as much as the time is reduced to prepare each subject, it is better. So these all videos that we are going to discuss gives a very crisp but yet a very informative information about each of the topics. So let's see the topics one by one. So basically in anatomy generally there will be totally around 10 to 15 questions asked for your PG entrance exam. And these are the topics from which majority of the questions are asked. So if you're confident about this list of topics, then it's pretty easy to attend it very confidently. So first one is about the posterior triangle. So this is the triangle that is present in the neck region behind the sternocleidomastoid. You have to know about its boundaries, its contents, as well as some of the applied anatomy. The next one is about the anterior triangle. So this is the one in front of the sternocleidomastoid. Again, you have to know the details regarding its roof, floor, boundaries and contents. Now this anterior triangle is very important because it is in turn divided into 3.5 triangles. So it is quite a big topic and it takes little bit more time to cover. And then we have the parotid gland. Parotid gland is the largest salivary gland. So in the corresponding videos, we will be seeing in detail about this gland. Another salivary gland that we will be discussing is the submandibular gland. Regarding both these two glands, the secretomotor pathway, the parasympathetic secretomotor pathway is very, very important. You have to know it in order. You have to know what is the ganglion that supplies it. You have to know the exact flowchart of the pathway. And in general, for the PG preparation, the most important things is if any of the structure is named, it is named after a person, then it will be asked as a MCQ. So whenever you see a new named structure in be it an artery, nerve, fascia or a plane, just make a note of it, highlight it, because every such named structure is a question. And then the next topic is maxillary artery. You will be seeing about the branches of maxillary artery, and then comes the muscles of mastication. What do you mean by mastication? It is chewing. There are 4 muscles involved in mastication process. Then we have the pterygopalatine fossa. So for any fossa, you should know once again its boundaries. Any communication, does it communicate with the adjacent fossa? In case yes, what is it? How is it communicating with the nearby fossas? As well as the contents. Then the next important topic is about the tongue. Okay, it's a muscular organ with intrinsic and extrinsic muscles. You have to know all the details about tongue. You have to know what ankyloglossia is, which is a clinical condition related to tongue. And then we'll move on to middle cranial fossa. So cranial fossa itself is very important. In that, to be very specific, the middle cranial fossa is very, very important. There are a lot of foramens and fissures present there. You should know what are the structures that are passing through each of these foramens and fissures. In addition to this, in the posterior cranial fossa, only the foramen magnum is very important. It consists of a list of structures passing through it. Then we'll move on to cavernous sinus. So what is cavernous sinus? It is a dural venous sinus that is present in the cranial cavity. So in detail, we will be seeing about its walls, what are the structures that passes through it, as well as the applied anatomy. Then among the 12 pairs of cranial nerves, 3 of the cranial nerves are very important. The first one is the 5th cranial nerve, that is trigeminal nerve. You have to remember, the moment you recall trigeminal nerve, you have to remember that it consists of 3 subdivisions or 3 divisions starting from ophthalmic, maxillary and mandibular nerve. Then we'll move on to the next cranial nerve, that is facial nerve. This is also very important. This is the most common nerve to be paralyzed. And why the trigeminal nerve is important is that is the structure that supplies the superior and inferior aspect of the dental. Through alveolar branches, it supplies the upper and lower rows of teeth. So while giving any anesthetic, local anesthetic, you will be approaching these nerves. So trigeminal nerve is very, very important. And then the 9th cranial nerve, glossopharyngeal nerve, it is important because it supplies the tongue. And so these are all the very important topics that you have to focus on. Once you're confident about this list of topics, the rest of it is pretty much easy. And if you finish all of this, you should probably take a break and then focus on the next two topics, which is quite long but yet very, very, very important. So pharynx and larynx are the most important topics. Definitely at least one question will be asked from either of this. So there are a lot of name structures present in the both of two. In detail, you will be seeing about each of these topics. Thank you.